Human papillomavirus, or HPV, is a group of non-enveloped DNA viruses. There are actually about 150 different forms of the virus that infect humans, and the virus itself is a circular shape and double-stranded. In terms of infection, the virus is passed from person to person through skin-to-skin contact with infected individuals. However, the most common form of transmission is through unprotected vaginal, anal, or oral sex with an infected individual. An infection from the virus can produce various symptoms. The most common symptoms are genital warts, as well as other warts such as plantar or flat. Additionally, a diagnosis of cervical cancer in almost all cases is an indication of the presence of the virus. There are also several factors that can place an individual at a greater risk of contracting the virus. First, as the virus is commonly passed through sexual contact, individuals with a higher number of sexual partners are at a greater risk. Along with that, individuals whose sexual partners also have a high number of partners are also at a higher risk. Additionally, individuals such as HIV or AIDS patients who have weakened immune systems are more likely to contract the virus. Finally, individuals with damaged skin and contact with infected individuals are at a higher risk as the virus infects individuals through openings in the skin. It is important to note that it is incredibly common for individuals to contract some type of the virus in their lifetime. However, a majority of the 150 plus types of the virus do not result in serious health problems. In most cases, the body's immune system will kill the virus before it can cause issues. It is common that about 14 million new people in the United States each year are infected. Additionally, about 80% of women will be infected with some type of the virus before they turn 50. While many infections from HPV may not cause serious health issues, there are several forms of the virus that can wreak havoc on the body. However, it is not uncommon for symptoms of infection to appear years after infection, making it hard to determine exactly when the infection began. The harmful forms of the virus can result in the development of various cancers such as cervical, vaginal, anal, and throat cancer. Taking a look into the history of the virus is important to understanding the virus today. In the 1950s, it was first discovered that there is a clear link between HPV and cervical cancer. This discovery began with Harold Zerhausen, a German scientist who observed that women who were known to have multiple sexual partners were more likely to be diagnosed with cervical cancer. Later, he also discovered that there was a connection between individuals with genital warts and cervical cancer. Finally, when it was discovered that genital warts and HPV were connected, the connection of HPV to cervical cancer soon followed. In fact, today, 99.7% of all cervical cancer cases are due to the presence of HPV. Today, there are also several vaccines that individuals can receive at a young age, typically between 11 and 12 years old, that can combat infection from harmful forms of the virus. The first vaccine was introduced in 2006 called Gardasil, which targets 4 known harmful forms of the virus, HPV 6, 11, 16, and 18. 2 more vaccines were introduced in 2009 and 2014 as well.
Since HPV is a sexually transmitted virus, nearly all men and women are affected at some point in their lives, meaning the public health concerns are extensive. HPV is spread through any form of sexual intercourse, even if the person carrying the infection has no symptoms. We're currently in a worldwide epidemic, with nearly 79 million Americans currently having some form of HPV, and as previously mentioned, another 14 million more will become infected each year. The most prevalent problem with HPV is that it is the main cause of cervical cancer, which was previously the #1 cause of cancer-related deaths for women in the United States and has since been bumped down to number 4. According to the CDC, 12,578 women were diagnosed with cervical cancer in the United States, and 4,115 died from cervical cancer in 2014. Around the world, over 5,000 women are diagnosed and over 275,000 will eventually die from cervical cancer. Over 2/3 of these cases could be prevented with the HPV vaccine. This map appeared in the renowned journal Nature in 2010 and depicts the worldwide incidence of HPV infections. This study on HPV found that most cervical infections cleared within 2 years will not cause cancer, but if left untreated, the infection will spread beyond the basal membrane and into deeper tissue, causing the cells to become cancerous. Only cervical cancer cases are shown here. This does not include any other types of cancers that are caused by HPV. This map shows cervical cancer-related deaths in 2012. It is evident from the previous map and this one that less developed countries are more at risk than countries such as the United States, Australia, and most of Western Europe. This is largely due to the lack of health care and limited to no access to vaccines that are able to prevent certain types of HPV. The first HPV vaccine became available in 2006 in the United States, which protects against HPV 16 and 18, the two most common HPV strains that cause cervical cancers. This vaccine, known as Gardasil, is safe for both men and women aged 9 through 26. Although its main purpose is to prevent cervical cancer, it is still recommended for males to receive the vaccine, as HPV is a sexually transmitted disease and can cause a slew of other problems in men, such as genital warts and anal cancer. There are over 100 types of HPV, most of which are not harmful. Gardasil only protects against 4 strains, 2 of which are collectively responsible for 70% of all cervical cancer cases. HPV 16 and 18 are also common causes of oropharyngeal cancers, often afflicting men, and the number of these cases are expected to surpass the number of cervical cancer cases by 2020. Although alarming, these statistics reflect a largely unvaccinated population. By promoting the vaccine and its effectiveness where it is available, the public health concerns for HPV will likely decrease significantly. In addition, providing vaccines in third world countries could prevent many cancer cases from ever occurring, saving many lives in the process.
Most people who are sexually active have HPV and don't even know it. Most strains don't cause any symptoms. The few types of HPV that can cause problems such as genital warts and cervical cancer are called high-risk HPV. Physicians can test for high-risk HPV in women by a test that is very similar to a Pap test. They swab the cervix and look for the DNA of the HPV virus. If the patient is positive for HPV, the physician can then determine which strain it is. There is currently no way to detect if a male has high-risk HPV if he does not have any symptoms. There is no treatment for HPV itself, but if a patient has high-risk HPV, it could cause abnormal cell changes that might lead to cancer. If a patient has an abnormal Pap test result, they may need further tests or treatment, including colposcopy, which is a procedure that looks more closely at the cervix to see if there are any precancerous cells, serotherapy, a treatment that freezes and removes precancerous cells from the cervix with liquid nitrogen, LEEP, or loop electrosurgical excision procedure, a treatment that removes precancerous cells from the cervix with an electrical current, conization, or cone biopsy, which removes the abnormal areas, or laser therapy, which uses light to burn away any abnormal cells. While there is no vaccine that can prevent the spread of HPV, there are vaccines that can help prevent the strains of HPV that can cause cancer or genital warts. There are 3 brands of this HPV vaccine: Gardasil, Gardasil 9, and Cervarix. All of these vaccines protect against HPV types 16 and 18, which are the 2 types that cause 70% of cervical cancer cases. Gardasil and Gardasil 9 protect against other strains of HPV as well. There is currently a lot of research that is being conducted in order to find a treatment or a cure for HPV. One example was in 2013, a phase 1 clinical trial was done to test the ability of an HIV drug to be used as a cure for HPV. Scientists Ian and Lynn Hampson conducted this clinical trial on women in Kenya, where HPV prevalence is 5 times higher than it is in the UK, and where cervical cancer is the number 1 cancer in women. This study followed 23 women who had precancerous cells in their cervix as a result of high-risk HPV. They were administered Lopamune, which is a combination of antiviral HIV drugs, for 2 weeks. The physicians had the participants administer it directly into their cervix using a pessary, which is a small device that is inserted into the vagina. This was done twice daily. 100% of patients missed at least 1 dose during the 2 weeks. But at the end of the trial, approximately 64% of the women now had no detectable precancerous cells in their cervix, and a further 18% also showed their diseases had regressed to low-grade HPV. This means that the lopamine treatment produced approximately an 80% overall improvement of the disease within 3 months. 1 year later, 82% of these women were HPV negative.